or systemic breakdowns in healthcare?
All the leaders up here are trying to figure out the microphone. At the bottom, there should be an on conflict. I can tell me. Oh, wait, I've done this before. The technology is awesome. Work. Intelligent. There you go. So for it. Sweet. So for that means I did not do this cowboy thing. Yeah. Could you repeat the question for us?
Yes, I will. I'll just wrap this one.
Yeah. So I'm looking to keep that one to That is, it's weird.
So we have about 13 questions.
Okay.
I'll just, I'm like, here, is this one here?
That means it's a big yes.
Very good. So, question number one. What does purpose-driven leadership look like when navigating institutional challenges or systemic breakdown in healthcare? What does that look like? You know, because she happens to
asked. I'll start.
Purpose-driven, that is a very good a key word within that question. And you have to have that goal in mind and the desire to move forward, if that makes sense. So despite coming across any particular barrier, because there's always going to be barriers, whether it's to going to school or getting that job or getting promoted in that particular arena, you want to stay focused and network. I know I mentioned this earlier, and networking opens doors in so many ways, you guys. So, you know, if there's a problem with tuition reimbursement, for instance, then you're going to, you network and find those people who can help you make other decisions to help improve those outcomes. I hope that helped.
Yeah, I'll add a little bit to that. I think as we and you all are moving into your nursing careers and nursing leadership roles, it's so important to remember your why you signed up for this torture in the first place, right? Why you study all those nights, because sometimes when you're working in systems, it can get a little bit difficult to remember that. And there's some nights I went home and I said, oh my gosh, let me sit on this. Let me remember why I'm doing this, because there's a bigger purpose behind all of this. So just making sure you remember that when times get hard.
Then, if you can imagine, you guys are one of hundreds of applicants. A lot of them are amongst your peers, right? And so you get this application amongst hundreds of applications. If you're that person that has a cover letter is your opportunity to introduce yourself. To say, hi, I'm so-and-so. This is my passion. This is why I want to work for your organization. So definitely you want to know a little about the organization, because you really want to work somewhere that goes to some points that were made up here. You don't want to pick a job just because it's a job or just because you're going to make the most amount of money. You want to pick it because that culture, that environment is going to support you. But going back to the career helping getting that job, you start with that resume, getting it top tier. Do the cover letter so you stand out as an individual. But also, believe it or not, we do mock interviews. So you can go and practice an interview with real people and get feedback. And you have to go a step beyond, because especially a lot of the Gen Z, but you guys just have not had or needed an opportunity to where you have to have interview clothing, right? And so you can get up to 6 outfits a year that's interview style clothing, and they'll help you decide, well, yeah, that's appropriate, no, that's not. So, see what services you have, because it can help you feel more comfortable. If you're doing those practice mock interviews and you have this cover letter that's really, really top tier, that confidence alone will help you create that conversation to get it going with the job.
So we've talked a lot about networking and things to do. I'm not going to tell you about the time I cried in the senator's office. That's a whole other story. It's very uncomfortable. It's hard because you do need something from that, right? But you also want to show the young continue that I really want to know who you are, or maybe you don't, maybe you really just want the job. But either way, that first year, once you guys get a job, that first year, focus on learning. I know a lot of people start school right immediately, and there's different views on that. My personal view is take that first year and learn, because you're still learning. You're not there yet. You just passed a test. That's all you've done so far. So get that first year under your belt, but join an organization. The Georgia Nurses Association is why I'm in my position right now. So I started working with them just because I was interested in advocating for for legislative initiatives for nurses, right? But I've been a nurse for 30 years, right? At year one, I could care less. I was just trying not to kill my patient, right? But at year 25, I was like, oh, maybe I should do something here. Look at what's happening. And so I joined the Georgia Nurses Association. I joined their finance committee, which is not anything I enjoy, but they needed somebody and I volunteered. So I was on their finance committee for like 4 years. Through then, I then was asked to interview or to testify at House hearings about nursing education. And that led to being noticed by members. And then it was on the Governor's Commission for Healthcare Workforce. All of that because I started on a finance committee that I had no interest in. So sometimes you have to give a little bit of your time in that networking to be able to actually network. And sometimes you can find that person sitting next to you at a restaurant or an hotel, or one of my colleagues was sitting in a bar. There's a lot of alcohol in my stories that he's sitting in a bar and he just started having this conversation with the person next to him. Come to find out, she was part of a medical place that did housing for students that he needed work with. They just happened to be sitting in a public place together. So sometimes it's getting out of that introvert shell. And I'm an introvert. I'm just like Mahogany. We're friendly introverts, right? But after this event, we're going to go sucker them about and kid. You're not. But it's going to be, I'm singing it out by myself now. Yeah. So all of that to say, networking is a space that you're comfortable with. And sometimes you have to do things that involve giving up your time, even though you don't necessarily want to.
Okay, you know.
So also to Caroline's question, I work on the floor, right, as a nurse. So we have their students come and do clinical rotation, some are doing externships, et cetera. And what I think kind of stands out the most in the students that we see are those students who come in and show genuine interest in learning that that's over early. Yeah. Don't show it too early because I won't be the crypto. Don't show it. Exactly, don't show it. Maybe 5 to 10. But come in and really show genuine interest in what we're doing. So if you're here with me, saying, hey, let's pull up these patient charts. I want you reading through them before we start touching patients and asking questions. I just had a student with me recently, and she asked me what's about myself outside of my job as well. Like, she really wanted to get to know. And that day ended with her getting off the number and asked me, here, talk to me if you have other questions. And that's how you kind of network and get to know nurses. Because if now she ever, wrote me and said, hey, do you want to write a letter or something? Sure. Because I understand the type of student you are, because you are really showing up as your full self in our time together. So I encourage people to show up as your full self. It's really intimidating, but if you truly start talking to the nurses or parent, you'll learn that not all of them are as intimidating as they sometimes look. So don't be afraid to show up as yourself if they ask questions and be interested. And then you won't see disingenuous when you start asking a job. Don't ask me for the first 10 years, ask me a question for it to be about a job, right? Let us get to know the people we're around first before we get straightened out with it.
All right, so we have 3 questions as relationized in the hub of the next section. So it's like 12 lots of watches outside. So if you guys want to continue, it's okay with the panel. I would love for y'all to answer their questions. But if you guys want to, you can step outside, grab your lunch, and then come back in. If it's okay with you all. Because this is like great conversation. I love it. I just want to let y'all know that you can go eat if you want to. Okay? And then you can bring it back in your education here as well. But go ahead with the raise hand for each of you. All right. So, good.
Good question.
I'm just kind of incorporating half the first minute to my Thursday. Or like, because my base thing is, I love learning, like, it doesn't like, they don't go on everything. But my thing, like, really changes them. I get past, like, the exact team and you start the person zone without all of stealing, sit down, actually needs to be.
Congratulations, first of all, we accepting that universe. I'm very sure to say, university, you are trying to love their pay, okay? So I'm sure nothing that first. I got my bachelor's, my master's, and my doctoral degree from Georgia State. It's Athens University, but you don't work. You wouldn't. Now, my opinion, the best thing is to know and accept that you know nothing. in the best way possible. You know, and if you know, if that helps. I know that sounds very simple, but if you open your mind to accepting that constructive criticism, because you don't want to go out there and not know the why, because you're going to hear documentary and all the time. Why? I bought a shirt that says why with question mark, because we already so much in line, which I appreciate, because we don't just do. And a lot of nurses get into just doing. We don't. We need to understand why. And so if you take it as just that constructive criticism to bond you into that awesome thirst that you're going to be there. And I really mean that genuinely. Now, there's a difference between constructive criticism and like disrespect or kind of a down topping someone. So if that's the case, thinking she's I'm on. So we got to your last day. Clear. I'm looking at it too.
Okay.
I'm going to make a comment for both the people who are doing the feedback and for the people who are receiving it. Because doing coaching the performance is one of the most difficult roles for nurse leaders and preceptors and for the instructors. It's very difficult. It's a really nuanced skill. But one of the things that we all have to get over, especially people who are doing the coaching, is that giving people constructive feedback is a kind of kindness. So you have to reach into your heart and find your compassion and say, I know this. She's got a lot of room to improve in this area. So if I don't tell her that she has to improve in this area and I let her go, then the next nurse that she works with is gonna have to figure out how to explain it. What happens when you end up having one person on the unit that everybody knows is not a strong performer, but nobody is caring enough, but we'll have to tell them. Now they're hung out, they feel isolated. So remember, when you're the preceptor and when you're the mentee, that coaching is an act of caring. So, in advice, one of these hacks out there is act on empathy. And I was actually Mahogany's instructor. Shout out to Mahogany. And so one of the things that I would always ask my students is, even before we begin, what would you like to accomplish today? Tell me your goals, right? And then at that moment, we can kind of make a plan to how you meet those goals. But if that ain't quite during the shifts, during the day, where there's some type of hubbub, maybe we have to have a critical or crucial conversation, we're going to sit there, we're going to talk some things out. Like, can you explain to me your thought process on why you did this particular behavior? And to me, that's being you. Number one, to recognize maybe where your fault was, but then number two, to get a sense of your thought process. But then number three, are you able to be accountable and own up to that thing that may have occurred? And personally, it allows for that really good open dialogue and respect and, again, accountability, because as they were saying, I will never, and I hope other leaders and other people don't do this, just sit there and, bash you and say, you shouldn't have done that. How dare you? I taught you everything that during school, right? No, that is the way to speak to any person. But the important thing to realize is that as you said, we're learning. You guys are still learning. There are some things you just won't know, whether they are considered soft skills or they're considered, the hard, real life nursing skills. There are just some things you won't know. And it's up to us to kind of be there and saying, hey, let's get on this boat together. Let's figure this out together. How can I best help you? But I want to make sure to understand where they went wrong and how to recognize that and try to kind of have a game plan so that we can kind of get past it so that change just doesn't occur again.
Yeah, and I just also wanted to add, give yourself breaks. We are human beings. We are not going to get everything right? Or reaching to myself right now, if I don't say that. We're not going to get everything right. And so if we put ourselves in such a position where hearing a word that's not quite right makes us break down, then we're doing a little bit too much, right? We need to take a step back, take the breath. And one skill that might help, in the moment, if you're doing a skill and a nurture week says, actually, no, that's not quite right, and then they tell you the right way. And it's so easy to get caught up kind of your emotions with that. But one thing that might be helpful is you to say, okay, so what I'm going to say is they show them X, Y, and Z. Repeat back what it is that they told you. And that way, instead of focusing on the fact that you're doing wrong, you're now focused on remembering the right steps that they told you it is.
So that may be a useful tip.
So I'm going to tell you a very brief story about after school. Now, I was not a traditional student. I stood out a lot because I was very gullible, when I probably shouldn't have been. But I learned very early to get there early. And keep in mind, 30 years ago, you have good way before. Get your patient information, write a 10-page handwritten carefully. I know you all heard this from your instructors older. And then you would go to clinical the next day. You better get there before your instructor does. And the care plan that you wrote in like a falls out on sleep with something crazy happened in the middle of the night. And it's your fault because your care plan is not in it. So that's the generation that I was in. One of my instructors one day was like, Sean, why are you giving this med? And I told her why I was giving that the other eye concern. She goes, no, I know why you're giving this med. And so I repeated what I just said. I rephrased what I just said because it was the right answer. She goes, no, why are you giving this med? This went on for 5 minutes. Every time I gave an answer, I had the same question, right? And in my mind, I'm like, I even said it one point because the doctor said so. Now the right answer, student, is never. I answered that one. And this went on for about 5 minutes, and finally she's like, Sean, I'm wondering why you're giving this med. I'm like, what the hell do you want to know? I'm like, okay, now, back in the day, you did not say that to your instructors. Now when it is you're a lot worse. I'm like, oh, she said, okay, as soon as that came out of my mouth, she was like, okay, that's all I wanted to know. Now, also, as soon as that came out of my mouth, in the 3 seconds that it took her to take a breath, I saw the whole conversation with my dad about I just got kicked out of nursing school with that. Later, I realized she was pushing me because she knew I could be better. She wasn't pushing me, and at the time I was thinking she didn't like me. What's it about? You were a stupid woman. I keep with the learn teeth people. They an old lady, right? It wasn't about her not liking me. It was about her actually caring about me and wanting to make me better. It took me until I graduated to understand that because she knew what I would have to do when I graduated. I didn't. And as an instructor now, I'm sharing that story with my students because I tell them up front, I'm going to push you. I'm going to push you in clinical. I'm still comfortable with questions. I'm going to put you in uncomfortable positions. I'm going to make you talk to the doctor. And it's not because I don't like them. It's because I don't want them to leave the profession. And it's because I want them to be stronger. So if you get critiqued in clinical, thank your instructor. Now, if they're disrespectful, report your instructor. But if it's nice and respectful, thank you. I appreciate the feedback. And then at the end of the day, you criticize yourself, not criticize, critique. Self-reflect. I know some schools have like a journal. Have your own journal. You don't turn it in, it's for you. Don't let anybody else read it, it's for you. And at the end of your first year out of school, go back and read it. And you'll see why those things happened. Walk away.
And with that, we'll complete our first panel. Give them a round of applause.
Sorry. I'll know what the other way. Like, I know me and I take a picture. Never over there. Never right there. Never right there. Where is it?
This video, by the way, but you're good.
I'm trying to find Daphne. That's me.
Right there. You know it. Right there.
I tried my David.
Said I know that.
You didn't look good.
Daddy, can you get a picture of all the assistants?
Herpes as well. Anytime I feel like there's an issue that's happening, whether it was maybe I cried in the car after work because I had something difficult to handle, I always remember why. And for me, my why was my father. When I was 18, he passed away a month into my freshman year of college. At that time, I did not want to be a nurse. But for me, I said, hey, what is that one particular job that in my mind that I can do to hopefully prevent sudden cardiac arrest for anyone else? That's how my father passed. So that's what I wanted to, hopefully prevent from other people. So anytime that there's a situation that's occurring, whether it's in my organization, my 9-to-5, or my personal organization, I always kind of revert back to, well, why am I here? What's the big picture? What's the big purpose? And even speaking to what Sean said for nurse residencies, I teach that as well. And so I always want to instill that when we are faced with difficult challenges, when we're faced with things that can sometimes bring uncertainty, always having the back of our minds, well, what is my purpose? What am I here to do? How can I serve other people? And then you will continue to grow and be a better person, not just for yourself, but for your patients.
I want to say everybody's made really good suggestions. I'm a big fan of the values-based leadership. So when you say purpose-driven leadership, it's kind of synonymous to me with values-based leadership. So know your values, as Irene said. And as Sean said, pick an organization that matches your values, right? That their mission is consistent with what you value. And I want to emphasize that magnet organizations usually align their purpose and mission most closely with what nurses do. That is how they are successful in advancing the nursing mission. So keep in mind that as a new graduate, starting in a magnet organization is not only going to match your values, but it's also going to help you advance your career later. In particular, if you want to be a leader in a magnet organization, you start in a magnet organization, that's always going to have that credential, right? If you start somewhere that's not magnet and then you want to go someplace that's magnet, as a leader, they might not advance your application because you haven't come from a magnet culture.
Thank you. That was good. So question number 2, and the third question I have, the students pose the question. So we all know currently right now, NGI is actually so fun with everything. There's a lot of funds that will be, a lot of things will be done. It's a lot of funds that people are receive, that they will be receiving. As an executive, how do you confront in the spiritual inequities and system? You now have the power to create. We can first
I've been volunteered. Dismantling inequities. That sounds huge, right? When I think about breaking down those things that we see, that we know are right. We all know, we all have a moral compass somewhere inside of us. See those things that we know are right and being bold enough and brave enough to do something about it rather than just sitting back and let it happen. So how do I try to do that? With True Synergy Birth Services, I started it because I got tired of seeing brown and queer families being neglected in life space, to be forced to try to assimilate into a birth culture that was not created with those environment. That didn't seem right to me. So I tried to do something about it. I'm trying to do something about it. I am doing something about it, actually. So I do that by creating True Synergy, where I purposefully and unapologetically have inclusivity built into my organization. Because I never want someone to come to me and say, hey, we're back here if you want dual support, we need child birth education. And then I'm giving up education where all the slides are of cisgender heteronormative couples. That does not seem that doesn't fit what they need, right? So I wanted to create a system where everyone was included. So that's what I've been doing. And I just think it's important to be willing to call out those things. And that can be really nerve-wracking when you're just starting out. But honestly, people see that someone's willing to do that, to call out what's not right. You actually stand out. So some people may be in a bad way, but to many people in a good way, they said, oh, wow, okay, we see what type of person that is. Okay, I just got called out by a new nuts, and I've been, a doctor for 20 years. Maybe I need to check myself about something. So being willing to do that is what's going to help dismantle those inequities.
I don't know that I can talk balance. So, again, my space is academics. And so I graduated from Kennesaw State University in Auschwitz. But when I was in college, I was first time going to college, first time graduating high school in Montgomery, I had a 1.9 GPA. I found a bar, they served minors, I went, and it wasn't that I wasn't academically astute, it was I had bad priorities. Kennesaw State gave me a congratulatory year off. And then I had to bust my butt to be able to bring my GPA back up to get into the program. At the time they only accepted students once a year, I was number 17 on the wait list, which I thought was really good because I had hundreds of students applying. So about 17 was pretty good. But then I was thinking, what am I going to do? This is what I want to do. Don't go take classes again and make an A again. So they ended up accepting a group in the spring. They took 16. I was number 17. A girl dropped out first day, decided she didn't want to be a nurse. That's how I got in. I call that divine intervention, right? So I use that now to understand there are inequities in how the students get into school. There are some schools that some students will not get into. So I'm looking at our university system and already looking at what is the benefit of a GPA of a 3.0 if you're only accepting 3.5s anyway. Where can we make space for students that are academically astute, just maybe didn't have the opportunities that other students had? How can we provide a space in nursing for them? Because they need to be there. And so we're looking at how can we increase student support, student access, and removing barriers to get into nursing school. Because at the end of the day, if you had more diverse graduates, you were going to have more diverse healthcare.
And I would actually like to speak to the fruition of her hard work. I'm the director of the DMP program at Georgia State University, and our undergraduate program, I'll start with them, recently decreased our admission GPA from 3.3 to 3.0 because it's hard to tell. Sometimes you're well-rounded students, they're doing so much, they might not have that 3.5 or above GPA because they were president of this and organizing that, but they were with the person next to them, or the applicant next to them, they have a 3.9, all they did, was school. And so to be able to take it to account the whole person and all that they're doing, the different activities. So that's one that came of that. But also removing the GRE, which is one of the exams required to get into our EFP program. So, then it does, and we did increase our GPA requirement for the DMU program, but it was like a 2.something at first. Now it's like a 3.0, but we're removing and changing things to make it more accessible. And by trying to find different ways for funding. We have like an assistantship program, so you could work with undergraduate students and get free education or, things like that. And then I wanted to speak a little bit on saying something, because that was mentioned as well. You may come across something that you may not feel is ethical or right, and it's hard. It's easier said than done to say, speak up, right? But one thing I would encourage you guys to do, and I've said it before, but get involved. If you're at a particular organization, let's say your hospital that you're working at, and you see some things that you're not quite happy about, you wish to change it, you would like to see change, nobody knows who you are, right? But then when you start to apply for this committee and join this subcommittee, and they start to see you and know you and understand who you are, it's not only going to let people know you, but it also increases your comfort level and your ability to speak up. Does that make sense? So it builds upon itself. Go on.
I believe that I constantly carry this notion of speaking out of this masculine inequities, that people tend to do a lot of talking and they don't tend to do a lot of action behind their words. And so you'll hear naysayers and you'll hear people always complaining about, well, this isn't working, this is failing. Like then they don't come up with the solution to help kind of progress getting from A to getting to P. And so with FRN, my organization, I looked at number one, how I felt as a nurse and the things that I had to overcome to get to where I am today is astounding to tell you. And I said, well, if I am in an environment that isn't serving me the way I know I need to be served, then I'm not going to sit here and to continue to ask you to help me. I'm going to say, hey, let me go to the wood shop and build my own table, right? Let me build my own chairs, my own center pieces, and then what we're going to do is invite other people to come along with me. I can't do everything by myself, but what I can do is create an environment that I can bring other people along with me so that they don't have to, number one, go through what I went through as a child growing up to even get into nursing school, and then so becoming a full-fledged nurse. killing it in the game, I believe. And so that they don't have to go through again some of those things. We can work together, we can build teams, we can build organizations together as a team and not work in such silos to to hit our mark or to make a difference in the world.
Jenna, just apologize. I think but I just want to say, as a leader, when I go into a new role or a new situation, one of the things that I look for is inflexibility. Oftentimes, we develop processes in education or in healthcare because we're trying to be efficient, but sometimes those efficiencies also are black and white mandates. When I think about having mandatory staff meetings, at the burden that puts on a new nurse and also a new mom, or high GPA averages for entry into school when, we couldn't do a holistic kind of admission assessment. So when you see inflexibility, it's probably not intended to be exclusive, but it results in excluding people. There are so many different pathways into the nursing profession, and I'm so grateful for that. When I graduated from nursing, the National Councils of State Boards and the colleges all wanted BSN to be the entry level into the profession. And still today we have associate degrees and that's entry into the profession. And oftentimes people start as an LPN to an associate degree to a baccalaureate degree. So I just want to say that we need nurses and we really need to get behind all these different pathways to the profession so that we can continue to have a strong nursing workforce.
Thank you. And a little bit before questions. I mean, just questions. So
if I ever meet a nurse that says, I no longer know, I no longer what to learn, I do everything I need to know, I'll come rush the other way because I want us to be able to give as much as we receive our students. So receive as much as we give so that we can be, again, in an area that we can always have that in mindset where we are shifting and adjusting and growing and maturing and all the things that we need to for our patients.
Similarly, I would say an open mindset, meaning, be open to change, be open to challenge, and be open to communicating your needs, your wants, your desires, and just, stay focused,
I wanted to say, and I love to say growth and open-mindedness, but really what I want to say is don't be afraid to take risk, all right? Calculated risk, think about it, but don't be afraid to take risks when it's time to change. We just came through this COVID pandemic, and it was very traumatic for all of us. And it was especially when nurses at the bedside were working very hard. In some cases, it was so stressful that people were afraid to change. They were afraid to take risks and do things differently because they were afraid that would make things worse. But when you think through the options of doing things the same versus changing them, sometimes taking a risk to try and change, that's a good thing to do. So don't be afraid to take risks when it's appropriate and when it's time to change.
For sure. Just want to add to that too, as I think the best medical leaders, or at least the ones that I've come across, are people we could tell are really listening to you when you speak to them. They aren't like seeing past you. They're actually talking to you. And when you talk, they're actually listening or receptive. And I think that that's a skill that any nurse leader is going to need to have, to listen more than they talk. Because it's when you listen that you're able to actually pinpoint what's the issue here. Where am I needed? Rather than assuming you know where you're needed. So I would just say definitely keep your ears open. And I think it starts at the bedside. So many times our patients who we're one-on-one with at the bedside, there's going to be a lot of needs they have, but they aren't necessarily coming out right and saying either. So it's about listening and hearing what isn't necessarily being said by just being observant and not in centering the patient rather than trying to center yourself in your own things.
If there were a couple things I could tell you guys about being nurse leaders or just nursing in general. One, be curious. Why did that happen? How did that happen? How did I get here? Be curious and be humble. There are things that you do not know. There are things I don't know. I literally had one of those motivation cards, kind of hokey, but I kept it on my door of my office as a new leader, and you just have to listen because I would like to talk. And so sometimes you don't need to talk. Sometimes you need to listen, but be curious. Be curious about a situation. If you're curious about something, you're going to ask questions, which means you're going to hear things. And if you're humble, you're going to approach it from a mindset that people are going to want to share. So, and then the other big thing is that the leader, regardless of everything else you hear today, your shadow. Your shadow. When you stand up, there are people that stand next to you that might be encompassed by your shadow. So your shadow is very important. How does that impact other people? When they're standing in your shadow, how do they feel? When they're standing next to you, how do you make them feel? When you're impacting their day-to-day life as a manager, how does that make them feel? Everything you do, everything you say impacts what they're going to do. And that's shadow leadership. When we had that leadership thing up earlier, that's all I kept thinking. Of all the mentors I've had, that was the most important thing. It's not about you, and it's about your shadow.
And that was actually wonderful. And actually, I had a question on that thing. Basically, finding your words, finding your leadership points, especially when it feels different. Sometimes you might say something, especially as a person studying languages. Sometimes when I'm responding to things, I have to kind of like translate it in French.
Right? Is perception and intent. That's what I've heard. So it may not be, it could be a language barrier. It could be a personality barrier. It could be a situational barrier. But I have been in so many situations where I have said something, right? And the person received it slowly differently than how I hear remotely intended into me. And it could be something as simple as, how you doing? And they took it like, oh, how am I doing? How about you? Okay. I meant, how are you doing? It depends on my mindset, how I'm standing, how I'm saying, how I'm speaking. Tone body language are very important, but then it also depends on where their mindset is. How many of you, by show of hands, have read a text in emotion, like with an emotion? Right? You read it with the emotion that you had at that time. So it can be a text that says, well, I'm busy right now, I'll call you back in a minute. You're like, I need it in a minute. He didn't look right. When they realize that, oh my God, I'm really busy right now, but I'm going to follow you, I want to talk to you. So just remember that how you say things is your intention. How it is received is perception. What I've been told that from my leadership all the time is that it's the perception that matters. And so I always try to keep in mind that it isn't about me, it's about how they're receiving me. And I do some accepting back and say, how did you take that? Because I want to make sure you took it how I meant it. And that's challenging. That's challenging.
Instrument.
I wanted to quickly say, as a leader in my organization, so my husband here, shout out to the Kirk, he's on my board, right? And so think about having to take off the white hat and put on the CEO chair founder hat. And someone says to your spouse who's also on your board, you're wrong. Who are you? That's not wrong. What are you talking about, right? But it could really just be, and as you just mentioned, maybe I said something that really probably wasn't intended for it to be heard that way. Or maybe I really am wrong, and my thought process on that situation, I just think just didn't understand a different perspective at that moment, right? So just because I have this idea of how something should go doesn't mean it's going to be set in stone. We have team members, we have an organization, we have people who kind of walk alongside us for a reason. Otherwise, we would be doing it all along, and it would take us 50 years to get that job done. I want to also give a quick story of me. This is going to sound really crazy, but when I was in 5th grade, and we were graduating from our middle school, right? And we had to have pictures of ourselves as babies on a little slideshow.
And what I told friend's parent, I said, hey, can I borrow your daughter's picture to put on the slideshow? She's like, sure. She didn't care, right? No one thought to ask me, why is this 12, 13-year-old little girl see for someone else's baby picture? And it's because I told myself that my thoughts and my ideas and how I felt about myself wasn't enough. I told myself I wasn't worthy. I told myself all of these different things as being right. And so as I'm sitting with my other students next to me and they see my picture go up there, y'all, look, I'm a little chocolate, right? I'm a little chocolate. So the person I chose, he looks a little bit lighter than me. And so they said, that's not right. Right? They recognize that. And so when I think about that little girl, I tell myself that I use that story or that feeling to mold how I am now and how I look at myself. My voice shakes a lot because I am so passionate about what I do. Sometimes I can't get, like my brain is going 1,000 miles an hour and I can't get the words to come out the exact same way that I'm saying it in my mind. But when you're facing challenges and you're facing situations that you may think, oh, well, maybe I did make that mistake, or maybe it's something a little bit deeper, and why I'm making this decision, you want to kind of take a step back and think and have that self-reflection, say, well, is it me? Am I the reason why this person it doesn't feel safe enough to come to me for this situation? Am I the reason why this person doesn't feel like they can trust me or confide in me? Maybe I gave it directed that they really, that either they just want to do it, or maybe I just let it clear, concise, complete in my directions. But kind of putting that mirror up to my face and saying, hey, this is who I am, but let me get to know this person, you get to know this person, and that's it. Because I'll keep going. So that's
Yeah, go with that. Also, I just wanted to say that when I heard what a lot of what Sean heard a while, but also a topic called microaggression. Does anybody in the room heard of microaggressions? So our colleagues, nurses and doctors, who have maybe English isn't their first language, or maybe they look different from us. I remember a nurse that I worked with like 30 years ago who was really sharp and really hardworking, but she had discolorations on her teeth from childhood illness or something. And it really impacts the way people perceive her. Microaggressions are when we pigeonhole people because of traits that they have. And so if you work with somebody who English isn't their first language and it's hard for you to understand what they're saying, work harder at understanding what they're saying. Listen more closely, because you can figure it out. You have to be meeting them where they are, right? You can't try to conform them, to get them to conform to what you can hear. You have to adjust you have to tune your hearing to the way that they're talking to you. And it's not easy, but it's it's the kind and equitable thing to do, right? Because just because someone, has a different language as their first language and it's harder to understand them, doesn't mean that they're not super intelligent, super compassionate, and super hardworking.
And to speak to communication and how sometimes it can be misinterpreted, I've been a nurse in the NICU for 9 years now. That's been the bulk of my nursing career. And never until recently has been, quote unquote, fired from patient, right? And I hold myself to very high regard. I love working with patients, explaining things to parents, and just like treating them like they aren't getting right. So when that happened to me, it was a patient who had been there for a long time, maybe 2 or 3 months. So I've never taken care of that care before. But I was paired with them that day, and unfortunately, it was a day that this baby would have made all this progress, started to backtrack. And so my mom was very upset, agitated, of course, right? She comes in, and first face she sees, and he's like, who are you? Type thing. Never seen you. My baby's been here for 2 months. And it didn't matter how calm I was, how involved I was, there was a wall there. And there was nothing I could do to break that wall down. So sometimes the miscommunication is not because you're failing as a nurse, right? It's just that connection isn't happening there. And it's totally out of your control sometimes. And that's okay. And even though I shouldn't tear, Okay, well, that was me. I still had to keep telling myself, you know what, there's nothing I could have done differently in that situation, and be okay with that, and know that, that's just the fluke. That's not my norm, and that's okay. God, but you want to know that too, because sometimes you can give it your all, you get it your best, and still you're running into a brick wall, and it's so easy to beat yourself up about that, but sometimes it's really not you. Don't say that.
Stupid. I just wanted to add a couple of things. Those were great informations. As far as assessing the situation, so sometimes you may have a conversation with someone and they're not in the mindset to receive what you're saying. They may have lost a loved one or argue with their spouse or lost a pet. Anything could be going on with that individual. And then this, they're not hearing what you're saying because they're not in the space to receive it. So just always, assess not just that other individual and, evaluate the place they're coming from, but also the physical environment as well. Is it the appropriate place to discuss A, B, and C? Me personally, I should have a hearing aid on right now. And so it would be a challenge for me, but you wouldn't know that I could hear every word, and it doesn't have to do with the language barrier. So, just being open-minded, I guess I should say, to what may be going on with the other individual as well.
It's
Peace, Butch.
My name's Carolyn Marion would be a to how that create state. So he's talking about networking a lot. And I talked
A scientific committee at the National Academy of Medicine about environmental health, and she has brought in the National Hispanic Nursing Association into the school, and she goes out and does research in rural areas with migrant farm workers. So I think that if I were you, I would start with networking with the Hispanic Nurse Association to meet people and find out what they're doing, because I do think that they're very active in meeting the needs of the community. And then the other nurse I just want to mention, Quinn Phan, who is Vietnamese, and she works with the community called Boat People in Atlanta. And she actually has a mobile van called Phan that she goes out to people in the community to provide mobile health care. So look for professional nursing organizations are excellent ways to reach out and advocate for your cause.
Yeah, and I just wanted to add, despite my last name, Kim Martinez, I am not Hispanic, but I'm like this. And to that note, though, anytime you want to advocate for something we build human, I think it's so important, like everyone else said, to be connected, right? It's hard to go out and advocate on their own, but we see those people standing on the corner on their own, So it's really good to get involved with other people, because your message is going to hit harder when there's a bunch of people saying the same thing. So I say, there are organizations out there, find one that aligns with what you are passionate about, and get connected with those people, because oftentimes those organizations aren't going to the Capitol and advocating for and against bills that are, going to be beneficial for their cause. So getting involved with that can be really helpful. Recently, I went into my first legislative hearing, and just with the intention to sit in that room in Georgia Capitol and just listen, but I was getting so murked up in their couch. And it was just bubbling inside of me. So when I had the opportunity to speak, I actually got in front of the panel and gave a testimony, and it was very empowering. And they recorded everything, so back on YouTube. I was watching myself like, oh my God, I said that, because I'm probably like, if something comes over you and you're just speaking from the heart. But I think it's so important to just get yourselves in those roles with the people who are doing that work, and kind of soak up everything that they're doing.
I just don't want to sound like a broken record, because networking is exactly what I was going to say. You have to reach it by those those professional nursing organizations specifically, since you want to make a difference in the nursing world for Hispanic nurses. There's quite a few of them. One of my colleagues, Dr. Jessica Marquez, she actually just she's in the process of creating a medical missionary event or whatnot yearly with our nursing students in the league. So she just got back a couple of weeks ago from that test program, in a sense, to kind of see the facility and meet the group of people. So there's so much that you can do, not just here, not just at your organization here, but you do worldwide. Cool.
I don't have anything to add, but I think that everything that these ladies up here next said is valuable and is super important. And also shout out to Dr. Marcus, because I know her too.
Like it seems like fabulous women tell their families. Yeah. And I mean, I'll get the mobile clinic information from you. What about students? See how we network just I can't wait. But it's two of my students wanted to work on the mobile clinic. So like, and it's different.
Gwen fan, yeah, you want to spell caps. Yeah, caps, the community, yeah. It's called In Motion is what the name of the project is. And so, yeah, they've got a band, yeah.
Question?
My name is Cello again, and I'm on the dance floor. And my question for y'all, I'm really down
To speak to creators and trust. So thank you for sharing. It just brings me back to nursing school. So I started out pre-med at one college, a chemistry major pre-med. It wasn't until I had finished 2 years of pre-med that I decided I wanted to be a nurse instead. So I had essentially taken a bunch of unnecessary classes for nursing, but had missed the opportunity to take actual prereqs. So some of them I was missing. So I still had to take a bunch of prereqs. And in the spring of 2019, that was going to be my last semester before I applied for fall admission to the nursing program. That was the worst semester of my nursing career, of my school career. I lost my dad in next semester, and my grade is pretty flat. And I never once had to go to my dean and say, how do I get this grade off my GPA because that a room in Kansas. And thankfully, the program I was at was Auburn at the time in Alabama. They had more of a holistic interview process. So they included an interview, they included a letter. So they were able to get to know me beyond that one semester, which would have literally destroyed our chances of getting in for the fall. So I think that's super important. And I'm so glad that so many programs are going toward that because we never know what's going on in a student's life. And one semester of bad grades does not represent who that student is. It's good.
Good question. So, my name is Bess. Like, so what there's students here.
Birthing that this is. Not the CNN yet. As a certified nurse midwife, I am in school to become a certified bliss midwife. But I am the founder, like she said, of True Synergy Birth Services. I created this solo dolo in 2021. I was out travel nursing in California, and I just saw a really big need for doula support, pregnancy support, specifically for Black, Brown, and queer birthing families. So that's why I created True Synergy. So very happy to be here.
Hi, everyone. Yeah, my role for Emory Healthcare and the Nell Hodgson Woodruff School of Nursing is as the Director for Academic Practice Integration. And that is a role that focuses on collaborations between the healthcare system and the School of Nursing to try to advance things like excellence in clinical education, workforce, and research. So thanks for having me.
We were started. Well, like she said, I'm Dr. Malia Stevens. I do a lot in the nursing world. And we'll talk about that, I guess, as we go through the panel. And then I do have mine. I'm just the owner and founder of a pantry company, believe it or not, because my second world is like chickens and stuff. Like, and no, they're not my chickens that'll feed into the dog. I have egg layers. But we're going to stick on ingredient pet treats. It is joy, but just joy free.
She has way more other hats than she wears. I'll let you tell them about.
Well, I just want to say real quick, don't let the alphabet soup behind the names discourage you. I had an RN, BSN, and that was it for many years. It took me 15 years to go back to school for my MSN because why would you do that again? I hated it the first time. And I'm an educator, which is funny. I don't let somebody's alphabet soup discourage you because all you need are those two letters, RN. It doesn't matter if it's an ASN, a BSN, an MSN, a DNP, a PhD, a EDD, a whatever. All you need are the two letters. So, hi, I'm Sean Lowell. I'm the Associate Vice Chancellor for Healthcare Education, which is a stupid title, but my job is to increase the nursing workforce within the state of Georgia through the educational system. So my job is to make sure we have more nursing graduates so that we have more nurses within the state.
All right, next up,
Both Indigo Foundation and it's a health and wellness organization. But we have a scholarship arm called the Institute for Future Registered Nurses are Incorporated. And we are on pending for nonprofit status. So hopefully we'll get that pretty soon for tax exempt. But what that organization does is we look to create environments that breed economic empowerment for women of color specifically, but for people who want to go to nursing school and to bridge that gap from them maybe struggling, maybe at home, and maybe don't have the funds to get to nursing school. So that is what our organization is. We are launching in 2026 officially to give out those scholarships to the students who are in need.
It's like you took a stage.